podcast. Today's episode is about narcissism. How to identify narcissist people, what their traits are, and what advice we can give to our audience. With us today we have two experts, Dr. Juan Sucozhañay and Dr. Kayla Pulgarin. They are two clinical psychologists from the University Politécnica Salesiana. They will share their knowledge and experiences on this topic.
Thank you for having us. It's a pleasure to be here.
Yes, thank you. I'm happy to discuss this important subject.
Okay, let's start by explaining with narcissism. Dr. Sucozhañay, can you tell us what narcissism means?
Sure. Narcissism is when a person thinks that are very important, just himself or just herself, and needs a lot of admiration from other people. So he or she doesn't care about others' feelings. So all the narcissistic people often believe that they are better than others and want to praise all the time. This can make it hard for them to have a good relationships with others.
Okay, Dr. Pulgarin, how can we identify narcissistic people in our daily lives?
There are many signs to look for. Narcissist people like to talk about themselves a lot. They may insult or look down on other people. They expect special training. They also often think are very talented and successful. They usually don't understand or care about the feelings of the other persons and always need praise and admiration.
Okay, that's very insightful. Dr. Sucozhañay, what are some common behaviors of narcissists?
Well, first of all, as I said before, narcissists often try to control other people or manipulate them. So they may use people to get what they want. Maybe if they want something, they try to get this, and they don't care about others' needs or maybe the feelings, as I said in the beginning. So they also tend to be jealous and think others are jealous of them, and also they blame others for their own problems and don't like criticism.
Okay, Dr. Pulgarin, how do these traits impact their relationships?
Narcissism traits can make relationships very difficult. Narcissists usually care more about their needs and wants than those of others. They can be very demanding and think they deserve special training, which causes many arguments and unhappiness in their relationships. Because they lack empathy, it's hard for them to have close and caring relationships.
Okay, that's so challenging. What advice would you give to someone dealing with a narcissist?
Well, this message is for all the audience, but first of all, you need to know that it's important to set clear boundaries and stick to them. Yeah, narcissists often try to push some limits, and because we have that it's crucial to keep those boundaries. So don't try to change these persons. Don't try to change narcissists. Instead, focus on taking care of yourself. Yeah, that's a message that maybe the audience can take. And maybe the reactions are something that they have to care about. So learning about narcissist behavior can help you understand and manage the challenges better, no?
Okay, great advice. Dr. Pulgarin, what about professional help and when should someone seek it?
If someone is very stressed or their mental health is suffering because of a relationship with a narcissist, they should seek professional help. Therapy can provide support, ways to cope, and a safe space to talk about their feelings. It's very important to get help if the relationships affect yourself or leads to anxiety or depression.
Okay, that's very helpful. Now let's discuss how narcissism can be diagnosed. Dr. Sucozhañay, can you explain the diagnostic criteria?
Well, first of all, it's a personality disorder. So it's called narcissistic personality disorder. And it's diagnosed when people has a pattern of grandiosity, needs a lot of admiration, attention, and lacks empathy. So this pattern starts when in early adulthood and is present in many situations. There's a lot of situations. So doctors or psychologists uses DSM-5, 5 edition, so it's a manual for mental disorders to check all these traits and their impact on the person's life and relationships.
Okay. Dr. Pulgarin, what is the treatment for NPD?
Treatment often involves therapy, like cognitive behavior therapy, which helps people understand their behavior and learn healthy ways to relate to others. Sometimes medications are used to treat problems like depression or anxiety that happen along with NPD. The goal of therapy is to help the person develop a more realistic view of themselves and have better relationships.
Okay, before we close, do you have any final recommendation for our listeners, Dr. Sucozhañay?
Yeah, first, remember that dealing with narcissistic people can be so tiring, so it's important to take care of yourself and seek support if you need it. Other thing that I want to talk about is learning about narcissists can help you handle these relationships better. So also recognize when the relationship is too harmful and take steps to protect your own mental health.
Okay, and Dr. Pulgarin, any last words for advice?
I recommend keeping realistic expectations. Understand that narcissists are not like to change much. Focus on what you can control, like your own reactions and boundaries. It also helps you to have support people around you who can give you an advice and encourage.
Okay, thank you for both for sharing your expertise today. And okay, this has been a very informative discussion, and it is important. To our listeners, we hope you found this episode helpful and enlightening. Remember to take care of yourselves and seek help if needed.
Thank you.
Thank you very much.
Okay, until next time, stay informed and take care.